Vitamin D supplements probably feature in the press more than just about any other supplements. There's a good chance you take them yourself, or you've at least considered taking one. Many people do. If you're not taking vitamin D, I've got 3 reasons why you should take a vitamin D supplement. As always, please do subscribe to our channel. It really does help us reach more people. And if you want to be alerted when we release more, hit that bell. So the first reason is if you work indoors. So vitamin D is made when the skin is exposed to sunlight. In the UK, over the winter months, the sun isn't strong enough for our bodies to be able to produce vitamin D. But our bodies are capable of producing enough throughout the summer months that our body can rely on reserves over the winter months. But if you work indoors, which many of us do, it can be hard to make enough vitamin D to last throughout the winter. Similarly, if you cover up in the summer, both clothing and sunscreen reduce vitamin D production. Low vitamin D and indeed vitamin D deficiency can easily occur if you don't get enough exposure to sunshine. But there is a fine line between enough exposure and too much exposure. So supplements are ideal for many of us. The second reason is if you've had a break or fracture. Bone breaks and fractures are common injuries, particularly if you exercise hard or if you're a little older. Vitamin D, though, is essential for supporting normal bones and muscles. And it's essential for calcium to be used correctly. It helps the absorption of calcium and prevents calcium loss through urine. So it's essential for normal bone structure and normal bone function. Used alongside calcium, vitamin D may help to repair bone damage that occurs from a break or fracture. As always, if you are undergoing medical supervision, talk to your healthcare provider before starting any supplements. And the third reason is for immune function. Colds and flu are probably the most common health ailments, but supplementing with vitamin D may help to ward off colds and help your body to fight off any infections that you do pick up. Admittedly, there are many factors that can affect immunity, but taking vitamin D alongside eating a healthy diet and good lifestyle choices could help. It is impossible to mention immunity without mentioning COVID nowadays. It has been suggested that low vitamin D levels could be linked to a greater risk of developing COVID. Now, unfortunately, no concrete evidence exists, and you should still practice all of your usual COVID measures. If you are concerned that you may be vitamin D deficient, then a blood test can be done to check. In the case of deficiency, the NHS will prescribe vitamin D, but a supplement is really handy for preventing deficiency, to top up your vitamin D before you run out. If you have enjoyed this video, as always, please do subscribe to our channel and hit that bell. You can be notified when we release more videos, and it will help us reach more people.